on the Executive Committee of the American Academy of Pediatrics, Council on Injury, Violence, and Poison Prevention. Welcome, Dr. Grace. And our third speaker, last but not least, Laura Reichhardt, APRN, is the director at the Hawaii State Center for Nursing, a certified adult gerontology primary care nurse practitioner. She currently serves on several boards, including the Hawaii State Rural Health Association, is an active member of the National Forum of State Nursing Workforce Centers, and has focused her efforts on state health and nursing policy and planning, workforce recruitment and retention, and statewide strategy.
Oh, sorry.
Mahalo for joining us as well, Lara. So we'd like to turn it over to Dr. Ignacio.
Okay, hi there. Let me make sure I have my presenter view up here and I'll get started. Thank you for your patience. Aloha, and can you guys hear me okay? Okay, aloha, good afternoon, and thank you for joining this hybrid web lecture, Leveraging Policy to Address Hawaii's Health Workforce Shortages. My name is Lisa Ignacio, and I'm an interventional radiologist in Maui. A little bit about myself, I'm an independent contractor. I've been in practice for 20 plus years, and I've had the opportunity through my work to observe many different health systems and practice models here in Hawaii. I serve as the HMA Legislative Chair for Government Affairs and as the year's HMA President-elect. And I've been invited here to review some of the legislative initiatives that we have supported to address our Hawaii physician shortage. It's a tall order. These discussions are much like choosing which adventure in a Jumanji game, but we can get as detailed as you would like in the discussion later. For now, I will present 2022 measures and the process of targeting priorities for us. My disclosure information, I have no relevant disclosures. And a little on who we are as HMA. HMA is a strong legislative body, and we are committed to the missions of professionalism, education, ethics, and standards of care. We serve the physicians and patients of Hawaii through representation and advocacy. And our GA committee brings together a diverse group of Hawaii physicians that represent primary care and specialties, as well as key non-physician healthcare consultants. In the search for answers, who are our partners? The answer is everyone here. Is that cornball? Is that sentimental? Not for Hawaii. Laulima literally means many hands working together. I cannot stress enough, and I was so excited about the words of Len Nichols and one of our prior speakers. It was so great. I cannot stress enough the need for engagement and collaboration of stakeholders, including all partners of our clinical teams, the academicians at UH, therapists, pharmacists, nurses, advanced providers, NPs, PAs, technologists, community patient advocates, our insurance carriers, our policymakers. You have some excellent advocates on this panel today who already understand this. If you arrive to this or any meeting or embark on any discussions today and your mind is completely 300% made up on some healthcare topic, it can be a challenge to do meaningful listening. No one attending this summit disputes that, sorry, I'm like, we're losing my place here. No one disputes the serious and even critical problems that we're facing in the Hawaii healthcare workforce. But understanding supply and resources, setting priorities to increase these, constructing clinical teams and infrastructure that maintain quality and safety, these are the nuances of creating policy that require everyone in order to be effective, achievable, and impactful for Hawaii. So you'll likely hear in other talks, there exist many programs from the Hawaii community and the Hawaii professional health organizations that are working to improve the practice environment in Hawaii, encouraging retention and recruitment of physician providers for Hawaii. I won't be detailing those in my talk, but I want to acknowledge this important work, and please don't miss out on the opportunity to learn more here at the summit on the Aimee Post-Baccalaureate Program, the UH Jabson supporting program that supports underrepresented students on their path to medicine, the Mauola Malama Lama scholarship program that's designed to bolster a culturally aware Native Hawaiian healthcare workforce, and the Jabson Rural Health Program, which provides students the opportunity to experience clinical practice in the neighbor islands. So here we are, we're in this canoe together, and we are in a perilous position. To put an exclamation point on that statement, as well as hone our focus on solutions, I'll share two headlines. These will look familiar to you only because we all read about this all the time. This is a recent AMA headline that says, pandemic pushes US doctor burnout to all-time high of 63%. This is an AMA article that was a large-scale physician survey, and it showed that overall 62.8% of physicians had at least one manifestation of burnout in 2021. And you can insert here all those things like fatigue, exhaustion, stress, diagnosed anxiety or depression, anger, substance abuse. And that's compared to 38.2 in 2020, 38.2% in 2020. And these trends were consistent across nearly all specialties. In a related COVID-19 impacts in Hawaii article by Dr. Withy, Ju, Potter et al. That was in the Hawaii Journal of Health and Social Welfare of April 2022, they documented that the pandemic caused practice disruptions, temporary and permanent clinical closures, early retirement, full or partial dependence on telehealth services, and reduced Hawaii physician office hours and reduced patient volume. Another headline, medicine's great resignation. 1 in 5 doctors plan to exit in 2 years. That's an AMA article that says that 1 in 5 physicians say it is likely that they will leave their current practice within 2 years. And meanwhile, about 1 in 3 doctors and other health professionals say they intend to reduce work hours in the next 12 months. That's recently published survey research. Let's look at Community First, who I know that they also presented their data, the patient advocacy organization. They presented their CDC-funded comprehensive survey for Hawaii and access to care and showed that over the past year 2022, 49%, almost half of Hawaii healthcare providers have considered reducing their hours. 44 to 47% think of leaving medicine and moving to the mainland. And if even 1/3 to 1/2 of Hawaii nurses and physicians carry out their expressed intentions to cut back or leave, we are looking at our Hawaii health system collapse. So let's take a microsecond and let those surveys at federal and state levels sink in. What are the answers? Do we fix COVID? I mean, hopefully the worst days of the pandemic are behind us. The jury is still out on that, but there is an urgent need to attend to our providers who themselves put everything into Hawaii's response to COVID, and too often at the expense of their own well-being. Other answers, what about improving morale? What about mental health resources, wellness programs? Some say we just need to make doctors more resilient. But I would put it to you here today that burnout isn't due only to a resiliency deficit here in Hawaii. It still is quite a systems issue. Resiliency training may have a role, but it is not the primary approach to reducing burnout and retaining physicians. AMA studies and our state studies, in fact, show that administrators, lawmakers, all of us need solutions that address the environmental system causes burnout. And what are the system drivers? We can put our answers into 2 kind of buckets. On the regulatory side, we can focus on supporting our physicians, removing obstacles and burdens that interfere with patient care, and prioritizing physician well-being as essential requirements to achieving Hawaii state health goals. It's a twofold approach. Obstacles are not simply reimbursement and taxes. They are any barriers to clinical work like patient screening and preventative health. So we need to work hard here in Hawaii. HMA has been an active voice in initiatives in partnership with AMA and in collaboration with carriers and government, calling for specific solutions and alternatives to prior authorization, interfacing with federal representatives for Medicare payment reform, telehealth expansion, and the prioritized focus on physician well-being. If I have time, I can delve deeper into these legislative measures, such as the new Improving Seniors Timely Access to Care Act of 2022 that passed the House on, I think, September 14th, like a week ago. That was wonderful progress. There's the SHOTS Connect bill and Telehealth Modernization Acts. These are both expansion for telehealth acts that are moving forward. They have positive momentum. All of these have positive bipartisan support and momentum. And along with the Lorna Breen Healthcare Provider Protection Act, which provides for mental health support for physician providers, HMA is engaged in interfacing with our federal legislators as well as AMA on these efforts, which will positively impact physician retention and support. Okay, to delve further into specific state measures, a little bit about our HMA preparation research. In the fall of 2021, in preparation for the 22 open legislative session, we had performed a provider interest assessment, and we published our legislative priorities. we'll do that again for 2023. I won't read this all to you, but I do love this graphic, which is developed by our executive director, Mr. Mark Alexander, and coordinator, Mr. Mark Conching. It's got my arrows on it, and they show the bidirectional bonding and relationship building that are the foundation of all of our government affairs work. Some of the good words that can jump out at you that you'll see include teams that are physician-led, physician shortage, addressing telehealth challenges and behavioral services challenges, including our patient Ohana in these conversations, and also addressing screening challenges. All of these align with our federal policy goals. So keeping those keywords in mind, we construct our Hawaii work groups, and I've listed them here with team leaders. As you can imagine, there's significant overlap with the subject matter of these 2022 work groups. I'm just looking funny at my slides because sometimes they're not advancing. The legislative core team assigns the bills with these graded priorities. And we started this year, we started about with 100 healthcare bills in January. A lot of work, a lot of review. Our work groups had many 7:30 a.m. meetings. Mahalo to our legislative committee. And so, with much discussion and research, we provided over 70 submissions of live and written testimony during House and Senate committee hearings. The testimony is a product of open dialogue and summarizes opinions shared, as well as review of scientific data, research regarding community, social, and financial impacts. The work groups are tasked to summarize and look at the testimony, to follow the hearings, address arguments, and add references. They will assess the need for meeting with our stakeholders and legislators. And I told you this process is for real. I mean, we take these conversations very seriously. And with these interactions and back and forth, we're trying to get to that support or neutral or oppose. We're looking for what we can all agree is best for our Hawaii health systems as a whole. This requires active, engaged, honest, open discussion, and meaningful listening. So our Access to Care work group assessed all bills related to access and health equity, as well as expanding incentives, which helps recruit and retain Hawaii physicians. We know that the healthcare workforce challenges for Hawaii they're so complex, and they do require more than one policy solution. HMA tracked about 27 bills this year in the 2022 session. And please note, of course, that we're highlighting here our high priority work. I'm not going to be able to cover all the bills in the interest of time, but I'm happy to delve into anything specifically that the audience would like to talk about. We do greatly appreciate the helpful guidance of our UH colleagues, particularly Dr. Kelly Withy, Director of the Hawaii and Pacific Basin Area Health Education Center, and the legislative team of UH, including Dr. Jairus Hedges, Dean of the UH John A. Burns School of Medicine. HMA is very pleased that SB 2597 passed successfully through House and Senate committees. The bill appropriated funds for the Hawaii State Loan Repayment Program administered through JAPSM, with matching federal funds through the National Health Services Corps. It was signed by Governor Ige in May 2022 and is official Act 263. So as HMA members, we know that medical school is extremely expensive. Right? This guy here that you see, 89% of our medical school graduates leave school, young physicians, with an average debt of $215,900 in education debt. That's, for medical school graduates, they can generally expect to earn a six-figure salary, but facing this massive amount of student loan debt is overwhelming. And it certainly impacts physician recruitment to Hawaii, where the cost of living is sky high. So I've heard some people say, oh, come on, they can pay that back quick. Sure, they can if they don't plan to eat or pay rent or, gosh, say start a family. These are really tough decisions for our young healthcare providers. So HMA also provided detailed written and live testimony for all measures seeking to expand general medical education. GME Bill 2657, that passed successfully through its House and Senate committees and appropriated monies to JAPSM to expand medical education and training in Hawaii, with an emphasis on supporting residency training on the neighbor islands and in medically underserved populations. The bill was signed into law July 7 by Governor Ige. So certainly HMA understands that the reestablishment of the Hawaii Medical Education Special Fund and other appropriations to increase residencies is highly important. We want to keep it as always in a priority to sustain the quality healthcare in Hawaii and maintain the delivery of vital services, particularly on the neighbor islands. So I guess it goes without saying that these measures do contribute to the expansion of our Hawaii physician workforce that remains critically low. I touched on alliances and partnerships early and wanted to highlight the connection of HMA with our patient advocacy partners at Community First, where we are working closely with Hawaii Rural Health Association Director Lisa Rance and Community First Director Randy Kurohara. Mahalo. No one disagrees that Hawaii physicians are struggling to keep the lights on while still providing quality health services. We know we must rely on our patient ohana and enlist their help and their clear, honest voices to forward our progress with Hawaii healthcare. Sorry, it's like, again, with the advancement of the slides. I do like this muted video, it's muted, but I want to show the heavy lift of the entire healthcare system, our community, our legislature, and our healthcare workers. I mentioned our 2022 HMA legislative priorities before, and with this project, we seek to address patient access challenges that make the practice and quality of medicine here in Hawaii, it's basically economically and personally unfeasible. It does contribute greatly to our woeful attrition of physician providers. So this CDC funded comprehensive survey, I hope you guys have had a chance to hear the talk and also review the report, but it documented the voices of our patients and their experience of healthcare access, especially on the neighbor islands. We're going to support legislative initiatives that grow from this data, and we'll address these challenges of patient and community real life experience. And now that the data is in, the work groups are forming to strategize or construct regulatory solutions. We urge you all to join us and the work groups to use data-driven solutions for healthcare in 2023. So in our work group for screening and preventative health, there were 24 bills this session that the HMA has followed, and we submitted live and written testimony on several of these. I'm pleased to report that the legislature was fully engaged on these measures. And you might ask, as most doctors would, well, doesn't everyone support screening and preventative health? Our patients remain the center of these decisions, and we should pause and remind ourselves that with all of these tools and protocols, there is a balance of science, epidemiology, quality, safety, and cost that must be closely reviewed. HMA appreciated the guidance and support of our liaisons and advocates. I think those words, again, that keep coming back to all of you: connectivity, lateral crosslinks, collaboration. Like Dr. Rennie Soon of the ACOG chapter of Hawaii, Dr. Cindy Gotu, a liaison for the American Lung Association, and Dr. Leighton Pang of Hawaii Radiological Society, who all shared their specialty expertise. And they imparted educational materials, data, and policy references to shape our HMA testimony. Checking the time here. I need to move a little faster, but I'm going to go through some of these bills. HCR 33, this resolution requested that the state auditor perform an assessment report for proposed mandatory health insurance coverage of early access breast cancer screening. Reviewing social and financial impacts. We had some excellent synergy on this measure. The resolution passed its House and Senate committee meetings, and HMA is now working closely with the state auditor on the subject matter. Mahalo to Dr. Shepard and Dr. Hernandez of the UH Cancer Center, the Association of Native Hawaiian Physicians, Ahahui Onakauka, the Hawaii Society of Clinical Oncology, and the ACOG chapter of Hawaii for their supportive testimony, as well as their guidance of our insurance commissioner and engaged policymakers. SB 2634 is a bill that appropriated money to extend Medicaid postpartum coverage to 12 months following the end of pregnancy. Dr. Soon and Dr. Gotu were important liaisons on this legislative work. On August 19, 2022, HHS approved 12-month extension of postpartum Medicaid and CHIP coverage in Hawaii. And that means that an additional 2,000 people are now eligible for this coverage. SB 3367 is a measure that created an early lung cancer screening task force to research the steps and resources necessary to increase early lung cancer screening in Hawaii. Thank you to Dr. Gotu of the American Lung Association for her references and coordination. This measure passed Senate and House hearings. It was enrolled to Governor Ige May 2022, Act 162. Yay. For those of you who don't already know, that lung cancer is the highest cancer-related mortality in the United States, and only 19% of new lung cancer cases in Hawaii are caught at an early stage, which is significantly lower than the national rate of 24%. This metric has not significantly changed for at least the last 5 years. HMA supported this measure and understand that the challenges of access and healthcare literacy can be addressed by the proposed task force, bringing together patient advocates, academic institutions, health systems, providers, and county and state government. So we're very excited that that measure passed. So we're mentioning that these policies are strong examples of our physician advocacy, SB 2736 for crisis outreach. These doctors who are working on this are in close dialogue with our policymakers and our carriers. They're pressing their voices. They're volunteering much of their time to maintain those cross-link connections and shore up gaps in healthcare, even as their own practices may be struggling to meet rent, supply inventory, PPE, and support staff for scheduling and administrative tasks. It's the physician's calling, it's true, but supporting these healthcare policies is one of the ways you all, as voters and constituents, can support not only your personal healthcare, but the policy infrastructure to deliver solid services in Hawaii and to decrease our physician burnout as well. I'm scrolling through our HMA work groups, and I touched on the telehealth progress at the federal level. We can definitely discuss these in greater detail if time permits. I do want to emphasize here with our scope of practice work group, HMA knows that health and wellness do not get delivered in a bubble. Physicians know well that we are part of a team. We do not have a monopoly on the delivery of health. HMA has been excited to rejuvenate partnerships in the last few years with other healthcare providers and professional organizations like our acupuncture colleagues, and be involved in the dialogue for certification and licensure so that we can all maintain high quality and safety for our patients. I hope that I stayed in my time limit. I could talk about the GA topics for the day long. That ends my portion of this discussion. And before I turn it over, I do want to thank our HMA executive leaders, Dr. Angela Pratt, Dr. Michael Champion, Dr. Tom Kosasa, Dr. Nadine Tensale for their teamwork during these past few years of the pandemic, our HMA organization growth and transition, and still keeping our government advocacy as a high priority. We are really blessed here in Hawaii to have physician officers and excellent staff, all of whom are deeply committed to our goals. Our collective community rewards are realized whenever our providers can focus on their clinical work and take care of our Hawaii patients without so many of the impediments and obstacles that hamper our calling. Mahalo for your time and attention. Thank you.
Mahalo, Dr. Ignacio. I'd like to open it up for Q&A. Any questions in the audience or our Zoom participants? Oh, we have a question. Now Greg can get his steps in.
Testing.
Thank you. I had a question in regard to the residencies, the state bill for 2657. How does that look for neighboring islands? What does that look like?
Dr. Ignacio, can you hear us?
I can hear. The question was, how does the GME expansion apply to the neighbor island residency programs?
Correct.
Yes.
Is that the correct? Okay. So the residency in the neighbor islands is still limited and trying to expand. So presently we have some primary care residency positions, and probably Aimee Grace can speak to this a little bit more because of her work on the GME stuff. But we are trying to expand to the neighbor islands, including Maui. I think that before the pandemic, we had made some progress in that regard, but we had to put a lot of this stuff on hold. I'm hopeful that because of this progress with the matching funds at the federal level and the state, that we can now have more resources to expand in the neighbor islands. I don't know if Dr. Grace has more comment on this topic.
She can address that. She's coming up next. So
There you go.
Thank you. Any other questions for Dr. Ignacio? We have one right up here in the front, Greg, please. Thank you.
And sorry, can you hear me?
Yeah.
Dr. Brankensejo Lum also wrote in from Zoom that part of the funding is dedicated to help support new rotations and expansion on the neighbor islands, proportion of their salary support, as well as for their housing and travel costs. And during my presentation, I'll talk a little bit about efforts on the federal level.
Thank you.
Thank you.
Hi, Dr. Ignacio, thank you for your summary of legislation. I just want to give you an update to the situation of acupuncture. I 2 days ago, I received an email because I'm also a member of a Hawaii Acupuncture Association. Plus, I'm a member of Hawaii Medical Association. I'm like a medical doctor, one foot in one foot in the other. And they were saying that they want November, they want to have another meeting because they think that failed last time the legislation. So they want to fight back again in 2023. They want to change their name to, instead of a Hawaii Acupuncture Association, they want to call Hawaii Acupuncture Medicine Association. Okay, now they inch by inch, they want to call themselves acupuncture physician. And so my biggest problem is that I really want the medical doctor getting the training on the medical doctor's course, and does not have to be governed by them and have to go through their 4 years of school to get that certification in Hawaii. That is my biggest goal. And we need to get that changed, but the language in that legislation is still, we're still working on it. I just want to give you a head that I just received 2 days ago. I want you to know that we're working on it. We need to get together with the Hawaii Medical Board and
Yes.
Hawaii Acupuncture Board. We need to get together in the big table and we talk about how we're going to make the language clear so the traditional Chinese medicine is properly presented, not become I call it mafia type of thing. I own this.
Understood.
So to be continued. Thank you.
Yes, thank you, Dr. Chen. Thanks for that update, and we'll keep working on it. I mean, there's a lot of stakeholders involved in that discussion. We're lucky here in Hawaii that we have a lot of acupuncture providers, and we want to work together to maintain quality. So thank you, and we'll keep working on it.
Thank you. Any other questions for Dr. Ignacio? We have a few minutes left for Q&A. If not, we can, oh, no, that wasn't. If not, we can go into Dr. Grace's presentation. Thank you, Dr. Ignacio.
Thank you.
When you're ready. Thank you.
All right, thank you so much, Dr. Ignacio, and thank you so much to the Hawaii State Rural Health Association and AHEC for having me today. And so nice to be with all of you and with my distinguished co-panelists. My name is Aimee Grace. As was mentioned, I direct strategic health initiatives and federal relations for the University of Hawaii system. I'm a pediatrician in a past life and went on to really believe in a lot of the policy issues that we're dealing with today and in terms of drivers of health. And so that's why I'm in this different role now. Sorry, I'm going to do it 2 ways. I have no relevant disclosures. So just briefly, I started off, like I mentioned, as a pediatrician, and then I just became very passionate through my residency, through public health school, of the importance of policy to improving health. You all have made me very excited today, perhaps perversely, because they're really big issues, but really policy is such a big driver of what these challenges are that I think the more we're all aware and working together to try to get to these policy solutions, the bigger difference and change we can all make. So yeah, briefly, I did a public health degree after my residency, and then I did a fellowship in Washington, DC, in general academic pediatrics, where I practiced as a pediatrician, but saw how frustrating it was to keep seeing the same issues pop up in my underserved population over and over on the individual level. So I ended up going to work for Senator Brian Schatz as his health policy advisor for several years in Washington, DC, where I learned a lot about legislation, the very exciting, to me at least, hopefully to many of you, the budget and appropriations process, because I believe that budgets are moral documents, and the more that we can seek to shift federal funding, the bigger difference we can make for our populations that need it most. There's also the whole regulatory angle and so many different angles on the federal side that I think we could be better leveraging as a state. So I just briefly in my time want to talk about policy as a mechanism to improve Hawaii's health workforce shortages through several different approaches. One is our U Healthy Hawaii initiative, which we're working on at the UH system and we'll share more about. One is a very exciting new initiative that all day I've been thinking about because it's very apropos to our conversations today. And that's a brand new Rural Health Research and Policy Center that is just getting started. We just got the notice of award 3 days ago. And then some various other federal initiatives. So U Healthy Hawaii was established in 2018, and it's our effort as a UH system to improve health and healthcare in Hawaii and the Pacific by leveraging the UH system's health sciences programs and forging meaningful collaborative partnerships. Does everyone have a connection to UH? Anyone? Oh, you're right, I'm sorry. I'm focusing on this one. Okay, thank you. Thank you very much. So probably most people here in Hawaii have a connection to UH. As you probably know, we have 10 different campuses across the state. Thank you. Okay, perfect. So between our programs, we have UH Manoa, we have UH Hilo, we have UH West Oahu, and we have 7 community colleges. We have phenomenal health sciences programs across our system. We also have AHEC at Jabson that many of you are very familiar with, the Hawaii State Center for Nursing that Laura represents so well. So it's really wonderful to work with all of these groups to form meaningful partnerships and to try to bring together what we do well to impact the state. Thank you. So we have 4 key priority areas. The first, most relevant to today, is ensuring a robust statewide health workforce. So I'll talk more about that. Briefly, and I'm not going to touch on these today, but we have a number of other initiatives going on, discovering and innovating to improve and extend lives, promoting healthier families and communities, and advancing health in all policies. But again, today I'm going to focus on the workforce. So again, what we want to do is leverage the UH system with our strong health sciences programs, as well as faculty, staff, graduates, and students that provide healthcare services to the people of Hawaii and the Pacific to address our state's healthcare workforce needs and service needs to make sure that we have a diverse workforce that reflects the ethnic makeup of our state. When I first came in about 4.5 years ago, born and raised here, but went away for quite a while after going to medical school here as well. We developed a matrix representing a menu of potential strategies to optimize Hawaii's health workforce. And today's summit is really fun because we see a lot of similar themes that a lot of us have been talking about for a long time in those solutions. We helped to work on the Hawaii's health workforce development for the 21st century legislative informational briefing, which was led by Senator Roz Baker and Representative John Mizuno in 2019, just before the pandemic. And we also put together this diagram, just starting to represent some of the many, many issues, like we said, it's very multifaceted, that contribute to Hawaii's health workforce shortages, including financial considerations, clinical practice considerations, family considerations, and pipeline or pathway or highway. I like that. The past couple of years, we had a small grant from the Hawaii Community Foundation to focus on improving Hawaii's health workforce. Just several of the topics that we worked on had to do with addressing our clinical site training shortages. At UH, we hear about that all the time, and Laura's shop is doing a lot in that space. We're trying to advance work groups on innovative care delivery models, such as telehealth and the role of pharmacists and community health workers in primary care. Also, various federal and state reimbursement policies. I know we're hearing a lot about that today, and interprofessional care. This was, before the pandemic, we really believed in telehealth. I worked on that a lot with Senator Schatz. Certainly, we all saw how important that was during the pandemic and want to make sure we have the workforce to support it. And then working on a handbook for high school principals to incorporate more health coursework for students at that level. Some efforts that we worked on with Dr. Kelly Withy's group is physician recruitment website. So AHEC has a number of great resources. They weren't at the time organized into one central recruitment website that we've now put on hawaiihealthcareers.com or through the AHEC website so that you can look at options, potential jobs, loan repayment options, housing and financing, like banks to talk to, and a number of more resources, including how to feel connected in your provider community. We also worked on a program called Homestay Aloha, where there's still a flyer out there that to try to address some of the housing issues for our students when they rotate on neighbor islands. I know I did a family medicine rotation on the island of Molokai, for example. It's really helpful if we have homestay hosts. So if anyone knows of anyone that would like to be involved in that program, please stop by the AHEC table outside. We've also worked to align with the health industry, including through the Healthcare Sector Partnerships Health Workforce Initiative, which is led by the Healthcare Association of Hawaii. As was shown by Dr. Nichols, they put out a report in 2019 outlining some of the professions in greatest need that are non-physician professions. We've been working on catalyzing planning for a Doctor of Physical Therapy program at UH Manoa, working to try to align what we're offering in our Thompson School of Social Work and Public Health with what the Hawaii State Department of Health needs, supporting JABSOM legislative requests for expansion to neighbor islands. And then we're working on some really exciting work, as Laura mentioned earlier, related to UH system proposals to try to address Hawaii's health workforce shortages in a comprehensive way. I'll just briefly mention our DOH, Department of Health, UH contact tracing training program, which was a $2.5 million grant that we worked on with DOH over a number of years, where we trained over 500 people who are eligible to be contact tracers. And what I think is really exciting that continues to today is that we're doing augmented community health worker training. So we've trained about 130 community health workers now through KCC. I just met one of them in the lunch line. So exciting program that we had a lot of different folks across UH working on together. Getting into some of the weeds of the federal work that I do, that our team does, we advocate for the federal budget and appropriations process. Again, this might sound boring, but I actually think it's really exciting. The more we see funds going to these programs, the more that can trickle down to our state and the more it can impact the populations that we want to serve. So for example, at JABSOM, there's a Native Hawaiian Center of Excellence that helps to support the Imi Ho'ola program and a lot of our pathway programs. That's under, and AHEC itself is under the Health Resources and Services Administration Title VII program. There's also a number of wonderful Title VIII programs that support nursing workforce, and we're particularly looking at trying to expand nursing workforce diversity. So I'm excited to talk today about our new Rural Health Research and Policy Center. I know when I worked on Capitol Hill, lots of people come to us with good ideas, but in order for us to make the case to the committee staff that actually make these decisions, we really need solid reports, solid evidence, solid data. And there are various groups in Hawaii that put this out, but not too many that really put it into the way of policy strategies that tell you what to do, how to do it, which statute to look at, which Republican, or in our case, Republican partners in other states to work with. This is what we want to do in this center. So this is a $1 million center that was just funded with thanks to some of our legislators federally through the earmark process last year. We want to conduct high quality and policy relevant research to develop policy recommendations to improve rural health in Hawaii. Want to focus on health workforce policy and health equity. And what I'm saying is producing actionable, evidence-based policy strategies. So we've talked a lot in the morning about, we need more reimbursement, but how do we get there? What components of the Medicare payment rate do we need to change? How do we change them? How do we make the case for that? With whom do we work? Who gives us labor market data? These are things that have to be talked about if we want to try to pass any of these policies. And that's what we're hoping to do. So we're working with AHEC and the Hawaii State Rural Health Association, as well as the State of Hawaii Office of Primary Care and Rural Health, and the Department of Health, and the Pacific Basin Telehealth Resource Center, and hopefully all of you. Again, just potential focus areas Number one, we keep hearing all the time about, again, the need for increased Medicare physician reimbursement, which then goes down to apply to lots of our professions here. Again, like I said, this is very complicated. All the different components that go into Medicare payments, how you make the case for them. So we're going to try to flesh this out and make it really strategic. I happen to know the backstory, which is a sort of a political ploy of how Alaska got a really sweet deal in this regard. I don't think we can do it that way, but there are other strategies I think we can use and try to use different levers to make the case for why we're similar to Alaska and we should have the same sort of special consideration. We keep hearing, and some of you probably know firsthand, that HRSA's health professional shortage area designation, or HPSA designation, doesn't always work for us in Hawaii because we're not all connected by land, because we have multi-generational households living together, and for a lot of different reasons. So we want to make the case for why we're different in non-contiguous areas. I can go on, advancing appropriations for other health workforce programs. The Medicare graduate medical education issue is complicated. We're excited that there is movement at the federal level to try to expand these residency programs after a couple-decade hiatus, but we don't think they prioritize non-contiguous areas enough. And then working with insurers on the state level to improve access to care. And many of these areas came from a collaborative paper that a lot of us worked on together about federal strategies to address Hawaii's health workforce challenges. Just briefly, we're open again to working with any of you on any of these. We're working to propose, hasn't passed yet, a non-contiguous areas health workforce initiative. The Health Resources and Services Administration, or HRSA, has a whole effort related to the US Delta region. You should see how many grants come out to support the Delta region. I am almost sure, I don't know for sure, but I can imagine that came because they had some strategic legislators, some strategic appropriators over the years who made the case for why the Delta region needs more support. I think we need to do the same thing for our non-contiguous areas and really make that case. And we could focus on a lot of the areas that we've all heard about today and that we know are in need, whether that's education and training, health workforce research, and more. Now, we've also been advocating with, again, a bipartisan effort with the University of Arkansas for Medical Sciences, where they have a lot of Pacific Islanders. We've been trying to advance a new VA Veterans Affairs Center for Native Hawaiian, Pacific Islander, and US affiliated Pacific Islander health. And finally, after several years of advocacy, $5 million was included for this center in the most recent House Appropriations bill. So I'm very hopeful that this will come to fruition and we can start this and grow it over the years to come to serve our veterans better. Just briefly, we also do a lot of responses to federal requests for information. These take a lot of time, but they're actually really important. The federal government will say, how can we improve primary care? And that takes a lot of effort to actually write back, to try to come up with, again, actionable evidence-based suggestions. But those are the sorts of things we've tried to do, whether on the National Institutes of Health Unite initiative to address racism and inequities in biomedical research, for the US Department of Agriculture, for the Census Bureau, et cetera. I would love to hear if you have more ideas that we could be working on. We're gonna have a team working on these issues. I'm really excited about it because I think it's the first of its kind in the state. But by all means, I put my email and phone number there. If anyone has questions or thoughts or comments, we would very much love to hear from you and work with you. Thank you very much.
Thank you, Dr. Grace. We'll open up for Q&A or suggestions for Dr. Grace. Right here in the middle. Sorry, we're trying to, sorry for the shuffling. We're trying to get your slides up for the Zoom. They couldn't see it, yeah.
Dr. Grace, for the rotation on the outer islands, are you going to increase the number of residency slots for the JABSOM residency programs? And if so, are you going to make it where the selection is for those residents that intend to stay as primary care in Hawaii?
Thank you so much. So I actually don't work directly for JABSOM. I think Dr. Brangansehulam is on Zoom. But briefly, I do know that, yes, we do want to expand residencies here. As many of you probably know, as Dean Hedges said, we have one of the highest retention rates in the country. If we find that physicians who do medical school and residency here, 80% of them stay here in Hawaii. So it's really important to us to expand those residency positions, because if we send people away for residency, I ended up coming back like 10 years later, but many people don't necessarily come back, as we know. There is a new Chan Zuckerberg fund at JABSOM, about $10 million, that's supporting a Kauai rural health training track, where you do need to commit to serving on Kauai. They're going to do this, I think, for 30 students. For when you graduate from residency, you have to come back and pay back year for year. So there's certainly an effort, and on the other islands as well.
So we have a comment from Zoom. Much of the residency selection process already does have high priority to remain in Hawaii and serve. Same for the medical student selection process. We have a couple questions. Would you be willing to attend Hawaii Impact Medicare Committee?
Sure. I'd love to hear more from you. Thank you.
And will APRNs be able to be on the committees?
And sorry, maybe you can clarify which committees. In terms of anyone we want to hear from, we would love to hear from you.
She didn't
The center?
refer to any specific.
Oh yeah, the center, anyone's welcome, by all means. We are going to be hiring staff and look to really work with all of you, with as many stakeholders as we can. So please do be in touch if you would like to.
And just have some comments of support here on the Zoom. Any other questions for Dr. Grace? Oh, we have some over here. Thank you.
I noticed you mentioned starting a physical therapy program at UH Manoa. Because Hawaii Pacific University has just opened their program, is UH still looking to do that as well?
Thank you. Yeah, we were all working on this for a number of years, and then the COVID pandemic hit. So we're still looking at options, but we still think it's very worthwhile to have a public option in the state. You may know the HPU option. I think there's a lot of promise there. It's an online hybrid accelerated model. So it's a little different than a traditional PT program. So yeah, we're still looking into it, but we don't have a formal program launched just yet.
We have one in the back. There's a comment on Zoom saying that the ability to develop new residency positions and programs that are supported by Medicare is very complicated. Going back to that, yeah.
Agree.
Hi. I hear you say that you are interested in working with anybody. Does that include people from other professions? Because I feel like what's been missing for me personally today has been the focus on the rest of us who are here who are not physicians. And we also have a major stake in healthcare.
Absolutely, totally agree. And I hope you heard me talk about the interprofessional models of care. I have a number of my friends here, whoop, whoop, from the pharmacy community. I've become actually a huge pharmacist champion, a community health worker champion, nurse champion. There's a lot, obviously all of your fields are critical. And for better or for worse, sadly, almost every single one of our professions is short right now. So we're working at the highest levels of UH system leadership to try to advance proposals that are gonna try to meet those needs, definitely not just in physicians, across the board, as much as we can do in the coming years. But thank you, that's very well taken and very important.
Thank you.
Oh, yeah. Okay, Dr. Grace, I'm internist of private practice. We understand in Hawaii, we have the shortage of many specialists, and some of the specialists, the primary care physicians cannot replace it, but certain areas such as psychology, psychiatrist, and the primary care doctor may help the patient for fulfilling this shortage. So I just wonder if UH Med School can sponsor some kind of training program for the primary care physician, and even can certify some of the program, and that really will help the community for those patients who need a psych care, for instance.
Yeah, thank you so much. That's a wonderful point. And actually, it was Dr. Kelly Withy who introduced me to the Project Echo model years ago when I worked for Senator Schatz, which helps to, for lack of a better word, upskill primary care providers in a number of different fields. That was, there's actually a cute video I didn't know that was going to show from Senator Schatz talking about the bill that we had introduced at the ECHO Act, which passed into law to try to advance Project Echo-like models across the nation. And that's been growing ever since. So certainly agree, and I think Project Echo is one of the best ways to do that. And I would defer to Dr. Kelly Withy because she helps to run that program.
Thank you, everybody. Any other final thoughts or questions for Dr. Aimee Grace? Oh, right here, great, please. Thank you.
I really just want to add the other doctor, the internist, to talk about the psych problems. And since I also had a energy medicine training from physician acupuncture, I really honestly say that if we can have a course to teach medical students or physician, primary care doctor, a little concept about energy medicine, the chi, the life force in our body that's missing in the medical school. If you learn that, you can help patients. It's not very difficult, it's fun, and you can help yourself. If we can bring that into our medical career, you can help so many patients very easily, and you can help yourself and your family. I wish that this program is going to get into it, and I'm working with the medical school, and this is our future, but hopefully it's a very near future, next month or so.
Thank you. And just to confirm, I'm not with the medical school formally, but yeah, I'm sure they're listening right now. And yeah, very important. Another initiative I didn't mention here, we're doing a Center for Indigenous Innovation and Health Equity. That's another area where we're looking at the restoration of ancestral and cultural practices to improve health for Native communities. And to your point, certainly a lot of what we traditionally know as medicine is not enough, right? Obviously, health is way more than just that. Thank you.
Yeah, a couple more questions. One in the back and then one in the middle.
Oh, hey, I just had a comment to make. Yeah, my name's Ryan. I'm an internist hospitalist. I've been here for about 10 years. I've seen probably, I don't know, half a dozen, 10 different physicians around my age, late 30s, early 40s, that wanted to stay in Hawaii, but had to leave Hawaii because they had kids, which, now is the age we're having kids, and they need support, they need help, so they go back to the mainland where their families can help them. Personally, I had kids, and my wife, who's a nurse practitioner, had to stop working because the demands of childcare, and with 2 kids, it's not worth it for her to work. I can earn enough for the family. So I just want to make a comment that I think helping with childcare, specifically for physicians, or nurse practitioners like my wife, providers, I guess, in Hawaii, I think could help retain a lot of people. I've seen quite a few in the 10 years I've been here leave specifically because of the burdens of childcare are too much in Hawaii, and they wanted to stay otherwise. That was the only reason. And my wife is ready to return to full-time work, but we can't because 2 kids. So I think that would be helpful if that could be pushed more in your agenda. Appreciate it.
As a mom, and I know we talk about this a lot, totally agree. So thank you. Yeah, let's try to put that, and along with housing and so many other spouse employment, right? There's so many people leave for some of these issues that we really should be able to address as a society. Thank you.
Aloha, Amy. Could you provide some insight into why Hawaii is the lowest reimbursed state in terms of Medicare, Medicaid?
It's a complicated topic. I don't think I can go into it in detail right now, but please rest assured, probably in the next 6 months, this is going to be the top priority that I have for the Rural Health Research and Policy Center, where we can dive into a lot of the different factors. Briefly, and it's very complicated, so I won't go into all of it because I'm sure I don't remember after all these years, but there's different components in the Medicare payment rates that has to do with work, physician practice expense, and malpractice insurance. Those are different components. They are all judged by a geographic, they're all like multiplied by a geographic practice cost index, a GPSI multiplier. And that's an issue that we think is not adequately recognizing the labor shortages and issues that we have recruiting here in Hawaii. There's many different components that go into that. A lot of people over the years, including myself when I was in Senator Schatz's office, tried to make the case for a lot of the issues that you all know so well about a lot of the rent, a lot of who you're competing with, that, you know, other, I believe it's counties or census tracts on the mainland can reclassify some of their index to a neighboring county. We can't do that, obviously, because we don't have a neighboring or neighboring state. So anyway, it's very complicated, but there's just basically, I think, and the same thing with the health professional shortage area designations. There's a lot of reasons that the federal government, just in its effort to just be standardized, doesn't recognize the unique issues that we have here in Hawaii. So we have to make the case for why they need to consider that. But please stay tuned for hopefully our first report to come out in the next 6 to 8 months, I would say.
Thank you, Dr. Grace. And we'll have a final Q&A, so if we have a little bit more time at the end, we can dive a little deeper. But we'd like to get into Laura Reichhart's presentation. She is the director of Hawaii State Center for Nursing. Welcome, Laura. No. Oh, yes. Okay.
Hello, everyone. So we have been trying to figure out how to make the screens visible for all. Thank you for the people on Zoom who let us know that it was not working for you. So if you just give me a second while I prepare. Because we're, oh, good, perfect. Can you, wait, is that mine? I'm not sharing my screen yet. That's really curious. So we're just, I have a background in improv dance, and what we're doing right now is an exercise in improv. If you want to do a physical activity with me later, I'll just meet you outside. And I'm a lot of fun. So I hope that this will be a fun presentation.
There we go.
All right. That was my wellness side hustle during graduate school in nursing. My name is Laura Reichhardt. I am the director of the Hawaii State Center for Nursing. I'm also on the board for the Hawaii State Rural Health Association. And a little bit about me is that I grew up in rural Arizona. And I was just thinking about when Aimee was sharing about her background, what were triggers for me and why did I come into healthcare? The school that I went to had the highest teen pregnancy rate in the nation. And I was the kid who would like go to parties with a bag of lollipops and a bag of condoms because I didn't want my friends to start smoking and I didn't want them to get pregnant or get STIs. I wanted them to get the future they wanted when they wanted to have it. So I went into public health first. I think that's a very public health story. But also in high school, I had some health needs, and when my parents weren't able to take me, I would drive 5.5 hours to another town by myself on the freeway, driving 85. Not advisable, but legally possible. And that's how I accessed healthcare. So I know what it's like to not have access in my own community because I lived it. And so I am a very strong rural advocate. And in our work at the Hawaii State Center for Nursing, we take so much pride in trying to extend the resources and opportunities that we have to our neighbor island colleagues, or as someone has recently started calling them sister island colleagues. I really like that because it's easier to get resources when you have resources. And so often in rural health, that's not the equation. And so we have to work harder to get those resources infused into the communities that have fewer resources to get the ball rolling. So today I'm going to talk about some of the priorities in rural Hawaii and then some priorities in nursing. They're pretty complementary to each other. And then I didn't talk a lot about the past legislative initiatives and specific bills. Dr. Ignacio talked specifically about several bills that HMA prioritized, and there's a lot of similarities and overlap. But I think it's also important to look forward. And so we don't have the bills introduced for the next legislative session. I can't provide those to you, but we can stay connected, and I'm happy to have those conversations with you. Also, I know everybody's bandwidth is spent, but the Hawaii State Rural Health Association does have a policy and advocacy committee, and you can do that nitty-gritty work with us, reviewing those bills and reviewing testimony and figuring out priorities. And it's a great lived experience, and it's a fun teamwork opportunity. So the Hawaii State Rural Health Association, let me change this so I can read things. Our mission is to advocate for rural health issues and promote communication, education, research, and research of issues related to rural health. And our vision is that we are a collaborative health leader for rural communities in Hawaii. We have a chapter on every island, and we actually have 2 chapters on the Big Island because it is a big island and we need that representation, and we're thankful for our colleagues. Our strategic goals, things are not moving around. It's not prepared for, disappear, there we go. Our strategic goals are to do advocacy for recruitment and retention, for physical, behavioral, and oral health, recruitment and retention of health workforce into the rural communities or from the rural communities, establish and maintain key county, state, and federal legislators, relationships with legislators and administrative staff, and establish and maintain key relationships with other organizations. I wanted to mention our mission and vision and our strategic goals because they're really important in identifying priorities. Both with the Center for Nursing and with the State Rural Health Association, we've established evidence-based policy platforms. And so our evidence-based policy platforms for both organizations that I'll be talking about, but particularly right now, the State Rural Health Association, is that we look at our mission and vision, we look at the evidence, we look at our community need, and that helps us identify what those priorities should be. So if there is a national movement, but we don't have the need in our community, we can't necessarily justify it. If it is a community need and if it's a community need and we have evidence, but it doesn't really support our mission and vision, it's just an outlier. We let it be an outlier. There's going to be other advocates. So that helps us identify and prioritize the work we do. So for the workforce, we've prioritized rural provider shortages and workforce development. So you can see how these go hand in hand. There thankfully has been good success with the loan repayments. To the comment earlier from the person asking about representation for other healthcare professions beyond physicians, I just want to say that if you look at the loan repayment professions that are the professions that are included in loan repayment, it is so broad. If you are a health practitioner on a neighbor island, it's pretty much you can be included in this loan repayment. And the website to get more information is the Hawaii Pacific Basin Area Health Education website. That's who's putting on this conference, and they have really great information on how to access that information and apply for loan repayment. The Preceptor Tax Credits is an initiative that I led, and we included other healthcare professions. So it is APRN, MD, DO, and pharmacy. There's $1.5 million a year allocated for Preceptor Tax Credits through 2025. If you're not a preceptor and you are an APRN, MD, DO, or pharmacist, please find me, or just Google Hawaii Preceptor Tax Credit and you'll find the website. You can register, and that will get us the information. We will send your information to each of the eligible schools, and they'll reach out to you and start getting you connected. And what that does is give you as the individual income tax credits on your state income. It's up to $5,000 a year. We are trying to get, it's for primary care providers only. We are trying to get, and this is initiative moving forward, the specialty providers who do really important training in our state to be included. We also recognize that when we launched the initiative in 2018, there were fewer health programs, and we have more health programs and health provider leading education in our state. So there are other initiatives to be more inclusive, and we've tried for several years to do that. So we will try again. And then we have a lot of conversations about the GET tax exemptions, GE tax exemptions. I really appreciated the comment on the first panel today that said, you know, that's essentially a 4% increase in revenue. There are other ways to get a 4% increase in revenue or decrease the cost of business or et cetera, et cetera. And so I think this is a solution, and then thinking about strategies that may not be the solution, maybe another solution works. But the important thing is that we're thinking about why this is a challenge. And we've heard it over and over and over again today. Cost of living is very high. Cost of business is very high. Cost to make someone able to live here, to be able to live in Hawaii despite the cost of living requires a lot of resources. And then there's an administrative burden that takes time. And so you have to kind of comb through and address all of those issues. Clearly that needs to be done. Workforce development. One of the really nice things that I think happens at the State Rural Health Association is that we do some advocacy, but we do a lot of action. And so a lot of the work that the State Rural Health Association does is pull down these initiatives. And thankfully we have Dr. Kelly Withy, who's a wonderful grant writer in addition to her other many skill sets. But she's able to, and we are able to work with our communities to pull down the grant funds from the federal government, but also from the state government. So when they have initiatives like opioid training for the healthcare workforce, or interprofessional healthcare education like Project ECHO, that's focused on the rural community, we're able to pull those monies down and make them accessible to Hawaii. It's also important that when we get those grants that we're able to respond to them. So we have a lot of that communication and relationship back to the funding partners. It helps us continue that work over time. And then one of the coolest things that happened during the pandemic, can't say there was many cool things that happened during the first 3 years of the pandemic, but we were having a listening session. We were having a board meeting, and actually Val Janikowski, she's in the back, right there in the center. You should raise your hand higher. She's a nurse. She's a representative from Lanai on the board, and she was bemoaning appropriately that there were no CNAs on Lanai, and there's actually a 12-year lapse of having any training program on that island. And the only way to get a CNA trained on Lanai is for that person to move to another island, and then they get their training, and then they get a really nice paying job, and then they're gone, and they have never come back to Lanai. And so we were able to, having tentacles in many places, having your ear on the pavement, able to be like, okay, well, I know that Maui County, Maui Workforce Development has some money, and I know that Ohana Pacific Management and Halemakua is working on CNA training, and I know that Lanai is in Maui, and you start connecting all these dots with all of your partners that may not be talking to each other, and now we have a CNA training program on Lanai, and you've had 2 or 3 cohorts, two cohorts. So those success stories, that's possible because Maui had money to spend, and we were able to partner it with a community in need. And then we were able to find the nurses, figure it out. We also have identified some federal barriers that we'll be telling Aimee about, but we also have identified some federal barriers that is preventing CNA training across our state, because it's requiring a certain experience or background for nurses. You have to have a year in long-term care, but on Lanai, like that's not necessarily the people who live there. You know, we don't have a long-term care facility. We have a lot of other really great resources. We have community health centers, we have clinics, we have a small hospital, we have, you know, we have home health. But none of those nurses, you know, were meeting that very strict criteria. And so we do have to start thinking about how we address those barriers. And so we're able to think from that lived experience, how can we start addressing these systemic problems? The other priorities that we have are priorities for the community. And I just in the presentation addressed them as workforce and community, but they're all interrelated. So one of our initiatives is opioid and substance abuse prevention. We have these really wonderful caring teams. They are communities on each island, and they are skilling themselves up and the community. And so doing work like being trained and then becoming trainers in mental health first aid and youth mental health first aid, which is really important. We have to be able to identify risks and crisis in the community. And because we know that the community, like myself as a kid handing out condoms, like I was a community member identifying a risk, right? We need that knowledge, and we need the community to feel welcome and supported in providing support to each other. Though that work is funded through HRSA grants. And so again, that's a federal initiative, pulling it down and then sustaining and matching funds within the community, and also passion and drive of community members. Improving access to care through local telehealth services. I don't think we've heard enough today about the Telehealth program, but what that does is fund, so make free behavioral health telehealth services with local behavioral health providers for rural residents. And then it also creates that pathway and connection for psych NPs, psychiatrists, psychologists who can establish and sustain that practice that they've created after having that initial connection. With primary prevention, one of the initiatives we really worked for and advocated for was expanding the Medquest coverage for oral health. And then we were just having a conversation, actually, Aimee and I were having a conversation yesterday about, well, what's happening, or a couple days ago, what's happening with the oral health workforce professionals? Do we know about a workforce shortage, or are we anticipating increased in demand? And it's like too soon to tell, but we know it's going to happen. And so keeping an eye on that, and so we can start anticipating and then responding to emerging needs. And then with health equity, you know, I think I just want to underscore the story on Lanai. We also had an initiative, grants were received and to support Molokai CNA training as well. So figuring out how to leverage and match, or just to remove silos. So if one partner is talking about something and you hear another partner talking to something, and then you realize they don't know each other, sometimes a simple greeting is all it takes. And then again, and this message, I think, for this track has been reiterated over and over and over again, and the Access to Care initiative with the Hawaii State Rural Health Association and Community First. Communicating the unique rural needs to stakeholders is so important. So we know that we know that HAH is doing that really wonderful workforce demand survey, but you can't take that only as your only data piece. You have to have the rural community represented on their own, because we know that Oahu will overshadow the rest of the state. So what do? We have to pull it apart. And that work, the work that the Access to Care work is doing, that report, that study, is really helping remove that shadow so we can look at the picture for rural needs. And that will also help prioritize. So that's really, really exciting work. In terms of priorities, legislative bills, everyone seems to be talking about this year that they don't have bills written yet. It's like the trend, it's the policy trend for 2022. We don't know what's going to happen in 2023. We know, though, that these issues are the big issues. I want to talk a little bit about nurses in Hawaii. So I also am the director of the Hawaii State Center for Nursing. We are established in state law. We are funded by nurses. So nurses in the room, thank you so much for funding and sustaining us. I have some of my team at this table over here, as well as I have board members sprinkled throughout. I'm so thankful for you being here as well. We are mandated by state law to do 4 things. Big things though: nursing workforce research. So we do research on the nurses, nursing workforce supply, as well as the capacity to train. So how our schools are performing. We also support evidence-based practice and nursing professional development. We know that we need to have a vibrant nursing workforce, and that includes creating opportunities for them to professionally develop throughout their career lifespan. And then we have 2 initiatives related to recruitment and retention of nurses. We support the clinical placement for about 80% of our nursing students in the state. It's complicated, it's complex, it's laborious, but it's critical to nursing education. Just as the residency programs are for medicine, we have a very different educational pathway, but it is very complex, and we have many more schools in our state for nursing. We also have the nurse residency program. We've established that about 12 years ago, and we are now very, very happy to report that we have a residency program in every county. The only island that it's not on is Molokai, because they tend to not hire new grads. And we've had like a 350% increase in utilization of residents. So more residents, more new graduates are getting hired in our state and getting really critical support in that first year of training. So that, or first year of practice. So those are some of our initiatives. We also support policy, because we know that having good laws protects the workforce and enables their work. And so that makes them more able to provide care, either because they're safe or because the laws are enabling access to care for patients. So all of that's what the Center for Nursing is. Our current themes that we're hearing right now is that we need to increase or amplify capacity to train. We have a faculty shortage. We do not have enough faculty to train the number of nurses that we were training in 2019, let alone the increased number of nurses we need because we have a nursing workforce shortage. If we don't increase the number of nursing faculty, we will not be able to meet the state's needs. And this is at the LPN level, this is at the associate degree level, this is at the baccalaureate level, the master's level, and the doctorate level. We do not have enough faculty, and we will not be able to meet our state's needs without change. It's a pretty terrifying statement. I will say, though, that we have had some successes. So the governor heard this crisis and prioritized funding 39 instructor positions across the UH system. And just last week, we learned that we received those monies at the UH system. So we are seeing improvement, and we know that we need to have more growth. There's a lot of effort, there's a lot of need, there's a lot of thinking about this, and all schools are advocating for the increase of their programs. We also know that we need more clinical training sites, and we need innovation. We had many more students in 2008, but there have been so many changes in the healthcare industry since that time that we're no longer able to train at that volume that we did in 2008. But we need to have growth somehow. And again, this is at the LPN, the ADN, the BSN, the MS, the DNP, the PhD, at all levels of care or all levels of learning. We need to have innovation in how we train, because we can't do things the way we did it before. It was resource intensive, but if we've looked at our population maps lately, like we are not getting more people, like we have, we're kind of a mushroom cloud. So we can't do more with less. We have to work in a better and smarter way. We need to improve access to care, primarily through improving the scope of practice at all license levels. We need to optimize team-based care by allowing every person to work to the top of their education and training. At the LPN level, at the RN level, at the APRN level, with our teams. We need to be optimizing, we need to be delegating, we need to be efficient, we need to be supportive, we need to understand each other's roles, we need to respect the different training methodologies, and we need to figure out how to be good team members. Because what's happened is we're holding all of each other back. I attended a leadership conference in July, and there was a conversation about, or a presentation about negotiation. And she was a local woman, I think she's working at Stanford now. And she said, she had us practice negotiation and we scored ourselves. And she said, okay, how many people got this score? How many people got this score? How many people got this score? And everybody got about 50%. And then she showed us the research and she says, everybody holds their cards close. You actually undercutting the value and what each person gains in negotiation on both sides of the negotiation. But if you're to show all your cards and you're to say, this is important to me and that's important to you, and I'm like, oh, I don't care about this, but I still want that. Who cares? We both get what we want. And that's happening or can happen in team-based care. If we don't understand each other's roles, maybe I'm trying to do the thing that my colleague can do better. I'd be happy to drop that so you can live your work life in a fuller way and do your job better. That is happening at all levels of care right now. And we have to kind of reinvest in each other and improve our understanding of each other's skill sets and also put things down.
Yeah. We have
Okay,
about 1 minute.
1 minute left. Okay, and then we have, and to reiterate that there is a federal law or a federal bill that just got implemented, and that is related to removing barriers to practice at the federal level. We also need to do that at the state level. So we do have full scope of practice authority, but we have a ton of laws that are outside of the Nurse Practice Act, but are outdated. And so improving those laws would also enable access to care. And then with well-being, I just want to prioritize the nurse staffing think tank. We identified issues in our state, and we had almost 100% overlap of the priorities that the nurse staffing think tank prioritized. So that's healthy work environment, diversity, equity, and inclusion, work schedule flexibility, stress injury continuum, innovative care delivery models, and total compensation. And to your point, to the gentleman, I don't see him anymore, about his wife leaving the workplace because of childcare, that's included in total compensation. It's also included in work flexibility. When we're talking about diversity and equity and inclusion, so important for our rural communities. But it's also considering that, enabling people, local people to enter into and complete education instead of having to rely on travelers. That's also a way for us to improve diversity and equity and inclusion. And then with a healthy work environment, really, really dialing down on this psychological and physical safety. We are very challenged in that right now, and creating a responsible workplace, not putting the responsibility on the person to climb that uphill battle of their own burnout, but recognizing that we have environmental changes that are necessary to make those improvements. So that is my presentation. Sorry, I was dive deep into that one. And if you have any questions, please let me know. My contact information is here, and I'm always accessible by email or phone.
Thank you, Laura. Thank you. I'd like to open up the floor for any questions for Laura.
Hi, ladies. Thank you so much for your presentation. I just wanted to touch on the different resources that are available for, like the newer providers, whether it be doctors, APRNs, PAs, kind of similarly to the gentleman's comment about childcare, but in terms of the loan repayments, and more specifically for the private practices, there are a ton of available loan repayment forgiveness options for those who are in a nonprofit, 501c3s, FQHCs, but there's very limited for those of us who choose to work in private practice. Especially, I'm from the Big Island. We're rural, all the things that come with rural, we experience. And I love what I do and I love where I'm at, but it's financially difficult for me to practice where I am with the amount of loans that I have. And there not being a whole lot of available options. And I know there's that small business solo practice loan repayment, but there's that as opposed to the other huge handful of options for those people who work in the hospital system or the FQHCs and stuff like that. So I'm just wondering, are there any other options for those of us who still choose to work in a rural private practice?
I think, if I'm not mistaken, and I don't see Kelly here, but if I'm not mistaken, I believe that the loan repayment program that she runs does support private practice. And I also think, Jenna, do you know if the Ben Hudnall Trust would also support that? So after these messages will be, no, yeah.
We have a question here. We also had a question which kind of ties into her question from Zoom. If there are any federal or state programs and resources that someone could tap into to gain help in recruiting, retaining their healthcare workers. Recruiting or retaining our healthcare workers, or if there are any federal or state resources that you know of that we can tap into. Oh, also in the next track. Okay, thank you. We had a question over there, Greg.
Yeah, I was wondering what connections there are to the Opioid Recovery Act for alternative therapies, trying to connect that. Is there anybody who has any information about that?
Yeah, if you can find me afterwards, I'm not quite sure exactly what the status is, but I can connect you with Kelly and Jana, who are working. We have a couple opioid grants, and Kelly also leads the physician group for the state opioid plan, or the provider group for the state opioid plan. And I think she would be able to better answer your questions related to that topic.
Okay. Is that only for nonprofit or is that also for profit?
I wouldn't be able to answer it.
Okay.
Mm-hmm.
We can take one last question.
Hi, I just had a quick question in reference to the Preceptor Tax Credits. Has there been discussions as far as preceptors being able to take students that are in online programs out of the state of Hawaii?
Yeah, that's a challenging question. Or it's a challenging answer. It's a short question, a long answer. The challenge is that we have to be able to implement a program. And so when you think about how is that information reported, it would be when we were talking about the feasibility and implementation, we didn't have any way to be secure in knowing that we are getting complete data collection, that we have a source to validate that training, et cetera. It becomes very, very, very complicated. And so that was the reason behind choosing only in-state programs, is because we know that our in-state programs are then they are then a member of the Preceptor Credit Assurance Committee. Each program is providing the information about their student engagement with preceptors. And we have a lengthy process where we can attest the veracity of the information. These are tax credits. Without the ability to confirm all of that information, We didn't feel like we would be able to do that in a way where we felt comfortable submitting that information to the state tax office. We have to ensure that we aren't providing or committing tax fraud. So that we are thinking about the list, the risk, the liability, the implementation. Because of all of those constraints, we chose those in-state programs only. That doesn't mean we shouldn't think of another option to support the really wonderful education preceptors are doing for students who have chosen out-of-state schools. We just haven't figured out what that option is yet.
Thank you. Thank you, ladies. So it's time. I know we have so many questions we can dig into, but I think it's time for ice cream. So we'll take a little break and we'll continue with session 3, which may be able to answer some of our questions. Thank you, everybody.